Answering additional questions about atrial fibrillation and syncope is heart-centered cardiologist Dr. Sarah Levin. How is atrial fibrillation treated?
Atrial fibrillation is treated in a number of ways. The issues with atrial fibrillation are twofold. One, the irregular and chaotic heartbeat in the upper chamber increases the risk of developing a blood clot in the upper chambers of the heart, the chambers referred to as the atria. In the presence of atrial fibrillation, it is important to discuss with your physician whether or not you need to be placed on a blood thinner to decrease your risk of stroke. Apart from the risk of stroke, the issue of atrial fibrillation then has to do with the irregularity or abnormal heartbeat itself. If you are unaware of the irregular heartbeat and you have no symptoms due to the atrial fibrillation, then our only concern is that the heart is not going too fast, and medicines can be used to treat this. If you have symptoms due to the atrial fibrillation, then there are a number of things that can be done, including medication therapy, aimed at either controlling the heart rates or treating the rhythm. And there are also invasive procedures that may be appropriate for certain patients called ablations.
Would a patient's blood have to be thinned to prevent a stroke even if their EKG doesn't indicate recent atrial fibrillation?
Atrial fibrillation increases the risk of developing a blood clot in the upper chambers of the heart. This increased risk of stroke exists whether or not you're in atrial fibrillation all the time or whether or not the atrial fibrillation comes and goes. This has been studied in many studies over many years, and we find that the most important thing to do to prevent stroke in people with atrial fibrillation is to treat them with appropriate blood thinners. Whether or not you need to be on a blood thinner needs to be determined between you and your physician depending on your own clinical risk factors. However, it should be emphasized that even if your heart is in normal rhythm the vast majority of time, the risk of stroke persists because most people with atrial fibrillation have arrhythmia that they're unaware of.
What is syncope and how do you evaluate it?
Syncope, otherwise known as fainting, is defined as the sudden transient loss of consciousness that is completely reversible. It is a very common problem, and many people will have many syncope or fainting episodes over time. Most of the time, the episodes are not dangerous and resolve completely and are not associated with underlying medical issues. However, in certain patients, syncope or fainting can be associated with significant cardiovascular disease, and therefore you should see your physician for further evaluation. The most important thing that you and your physician will do during your visit to discuss your syncope is a history. The history provides a significant amount of very important information as to the possible causes and also how dangerous the episodes may be. Depending on the type of episode that you had and depending on your clinical profiles, the workup of fainting or syncope can include an electrocardiogram, cardiovascular assessments including echocardiography, and various other types of monitoring.
How do you treat syncope?
The treatment of syncope depends on the cause. If you're a young person with a structurally normal heart and suffer from episodes of what we refer to as neurocardiogenic or vaguely mediated syncope, the most important thing you can do is to realize when an episode is beginning so that you can avoid a severe fainting episode. If you are an older person or if you do have significant structural heart disease, then further intervention and evaluation may be warranted. The presence of both abnormally slow and fast heart rhythms can cause fainting episodes, and depending on whether or not a slow or fast heart rhythm is present, an intervention may be warranted, including a pacemaker for a slow heartbeat and possibly an ablation procedure or other intervention for fast heartbeats. Abnormal fast heartbeats from the lower chambers of the heart can also be a signal of the presence of significant underlying coronary disease, and this does need to be considered between you and your physician. In addition, weakening of the heart muscle can also be related with fainting episodes, and this should also be evaluated. Depending on the fainting episodes and your clinical risk factors, various evaluations may be undertaken, and these should be discussed with your physician. Finally, the presence of infection, dehydration, and medicines that could be worsening your fainting episodes should also be evaluated.